Hello. Do you have concerns around the cost for COVID-19 treatment? There is a federal law in place that covers the cost of COVID-19 testing, but there's no federal legislation regarding the cost of the treatment of the virus, such as hospitalizations or extended care. Treatment costs depend on the type of health insurance a patient has. According to the Kaiser Family Foundation, people with large employer-sponsored health insurance face lower COVID-related costs than those with coverage through small businesses and the individual market, since the latter two forms of health coverage generally have higher deductibles. Some states have required all state-regulated insurers to waive cost sharing for COVID-19 treatment, but Connecticut is not one of them. Some insurers have voluntarily waived some or all of the treatment costs. According to Kaiser Family Foundation, while self-funded plans, employers decide whether treatment costs will be covered or not. Ted Doolittle, the state of Connecticut's healthcare advocate, urged consumers to question any unexpected or surprise bills that they receive for COVID-19 treatment. His office provides information on healthcare insurance enrollment, coverage or billing questions, claims denials, pre-authorization issues, explanations regarding a healthcare benefit, program or coverage, an assessment of the healthcare plans offered in Connecticut, consumers' rights and responsibilities as a healthcare plan member, referral and pre-authorization procedures required by a healthcare plan, and help with the healthcare plan's internal and external appeals process. Those patients with Medicare are covered for COVID-related inpatient hospital and skilled nursing facility costs, some home health care visits, and hospice care under Part A. Under Part B, outpatient services, physician visits, emergency ambulance transportation, and emergency room visits. Those covered by Medicaid have little to no cost sharing. The Families First Coronavirus Response Act requires states to cover COVID-19 treatment for those with Medicaid without cost sharing as one of the conditions to access an increase in the federal match rate for Medicaid. Those with no health insurance may be able to access free services. The government has set aside a portion of the funding for hospitals and other providers included in the CARES Act to help pay for treatment for those with no insurance. Providers can apply to this fund to be reimbursed for treating an uninsured patient. Providers can also decide on a case-by-case basis whether to bill an uninsured patient or apply for the reimbursement. As COVID-19 cases are increasing, restrictions are quickly changing. For the most relevant regulations where you live, visit portal.ct.gov/coronavirus. To learn more, visit www.ctcps.org.